Hi, I'm Dr. Joy, licensed clinical psychologist and founder of Therapy for Black Girls. Whether you're an introvert or an extrovert, many of us can say that at one time we felt nervous or anxious about a social event or an interaction. However, today we're here to talk about social anxiety disorder, which differs from the typical frustration we might experience from having to conduct things like small talk. Social anxiety is the constant, intense fear of participating in social situations because of the belief that you may be judged or evaluated negatively by others. Though the severity of social anxiety may look different for different people, many people with social anxiety will avoid social situations altogether for fear of doing something embarrassing or humiliating, even if it is to our detriment, like not going to an important interview for your dream job just because you're afraid of how you might be perceived. Today, I'll be offering some tips and advice for those of you who may be struggling with social anxiety, and hopefully, it'll help you to ease some of your fears. One of the best ways to combat your social anxiety is by challenging the negative thoughts you're having. Anxiety often has the ability to trick us into thinking that something is harmful without any evidence to back it up. When you find yourself feeling scared to enter a social situation, ask yourself, what evidence do I have to prove that this will go wrong? An example might be right before going out with a friend. Has this friend ever said or done anything that has made you feel judged for expressing yourself? Has this friend ever said that they feel burdened by you? I venture to say that the answer to these questions will be no. Asking yourself these kinds of questions can inject some rationality into otherwise irrational thoughts. Another way to work on your social anxiety is by finding low risk ways to be social. Often, when we're dealing with social anxiety, we may go for the biggest and scariest interaction first, and of course, because of our lack of practice, it may go wrong, and we'll use that as evidence to never try again. Finding small ways to build up your confidence socially can be a great way to make steps toward those bigger and scarier things. Lastly, in addition to therapy, consider scheduling an appointment with a psychiatrist to explore whether starting medications could be a great option for you. There are lots of medicines out there that have been great for helping lessen the heavy feelings of anxiety so that you can make those social interactions easier. I hope that these tips were helpful. And as we wrap up, I'd like to share one last tidbit from Therapy for Black Girls podcast titled Managing Social Anxiety. But we talked about the fact that one of the most important parts of developing a strategy for managing anxiety is to get away from avoiding the thing that makes us anxious. So you want to not avoid. Anxiety tricks you into believing that this thing is big and scary, and you should, of course, stay away from it. And then you do. So you never learn the skills to realize that this thing really isn't that big and scary. So whatever way you choose to work through your anxiety, make sure that a large part of it is going toward the thing that makes you anxious and not away from it. Sis, thank you so much for joining me for today's video. I hope you found it informative and insightful. Don't forget to hit the subscribe button and ring that notification bell so that you'll get our future videos. If you're interested in hearing more from the podcast, visit us at therapyforblackgirls.com/podcast. And if you're looking for a therapist in your area, check out our therapist directory at therapyforblackgirls.com/directory. And if you want to continue digging into these kinds of topics or just connect with other sisters across the world, come on over and join us in the Sister Circle. It's our cozy corner of the internet designed just for Black women. You can join us at community.therapyforblackgirls.com. Until next time, take good care.